Hey everyone, Dr. Charlie Johnson, a physical therapist. Super excited to share with you a live case study of a gentleman just got off the phone with. This is actually a live recording of me kind of chatting with him and working through trying to solve whether or not his back and leg problem is due to, or his butt, sorry, and leg problem is due to a back problem, a buttock problem, like a piriformis issue, which he actually thinks it is going in, and or like a sciatic type problem or some combination thereof. So these problems can be super challenging to try to figure out what's going on and where the kind of origin of symptoms is located. But as you'll see, through some kind of careful examination and some teasing out of back motion, hip motion, leg motion, we can get a good idea of, hey, number one, this is where we think the problem is originating. And number two, here's what we think we can do about it. So I'm going to kind of voice over or speak over the evaluation, stop it step by step as I gather the information so you can see what's going through my head. And if you present with a similar case, and he doesn't have back pain, he just has buttock pain. But as you'll see, there might be something going on upstairs that's having a downstream effect. So let's walk through it so that you can do the same thing on your own and walk step by step through me. So here we go. We're going to walk through the case study now. All right, so before we go through it, I'm going to hit play here in a moment, but the gentleman's name is Tim. He's been dealing with a year of buttock and leg pain. It started a day after he was working on his car. So there seems to be some kind of reason for the aggravation potentially there. And it's just in his right leg. His left leg is completely fine. He's tried chiropractic. He's tried PT. He's tried injections, gabapentin, muscle relaxants, things like that, and he's getting no relief. So we're going to try to solve the problem for him, and we're going to do it right now. So meet Tim. Worsen it necessarily. If anything, if you do it long enough, it can maybe make it feel a bit better, especially if you pull it. Like what happens again if you pull it? Again, you're lifting your right butt cheek.
Right. It does take the pressure off it, but like, is it?
So he does that motion. This is an easy motion you can do at home. Just kind of cross your leg over, flop it over your, put the ankle on your knee and kind of pull it up, press it down, right? And pulling it up stretches the piriformis. So in his case, he relieves some pressure on it and pulling it actually feels good. So right away, I can pretty much say, based off some basic rules of kind of evaluating, in this case, muscle tissue, the piriformis is a muscle. Look, if a muscle is a problem and or if a nerve is a problem and you pull on it, generally it's going to cause some type of pain. So if you cause some type of strain in a muscle and then you try to stretch it, it's going to cause some type of issue. Also, if you contract it, so I don't walk him through a contraction test for the piriformis, but the point is that we do stretch the hip musculature, and I'll be up front, we're stretching many things here, but in most cases, this is going to cause some type of reproduction of piriformis pain. So even though he's complaining of burning in the right butt cheek, going down the back of the leg, sometimes even into the right foot, it is not a piriformis problem as he can pull on it. And again, it's really low on the likelihood that it's something there. So already this makes him feel better. Probably not a piriformis issue causing his buttock pain.
Is it that or because I'm stretching it? I don't know.
Okay, other side. You can't
Cool.
see, but
Equal
his other
motion,
side,
that one's fine too.
His other side is fine.
Oh,
Okay,
yeah.
turn to the side if you can, and show me your leg raise again. So on the right side and then the left side. Can you do it? Testing for nerve sensitivity, better known as sciatica in the leg via a leg raise. Remember, if you've got a nerve and it starts up at the butt cheek and it goes all the way down the leg and you stretch it by kicking your leg up, you're going to cause some type of pain or problem in it. In the majority of people, more than 90% of people, if they have sciatica, they won't be able to do this. So we're going to look at it.
Yep.
His right leg, that's the painful leg. No problem. Cool. Any pain or problems?
Yeah, just the burning, and it doesn't get really worse or better. It's just constant.
Yep, exactly. That doesn't impact it, and it's no less restricted than your left side.
I don't believe so. No, it's about the same. Now, one thing I just thought of that I should probably mention. This past October and the previous October, I had each one of those times I had really bad hamstring pull. Okay, so probably he is just kind of projecting that because he thinks that's what it is. It may or may not have been. It may have been a nerve problem. It may have been some other problem, but he is describing it as a hamstring thing. And he's questioning, Charlie, could this be a hamstring problem? So what I'm going to do is I'm just going to bring him through a quick test. If you watch my diagnostic video, you'll see this in the diagnostic flow chart.
if you have a hamstring problem, again, you can either stretch a muscle if it's a problem, and that will usually bring it on, or you can contract it. So a simple test he's going to do is he's just going to lay on his back, kind of dig his heel. It's hard to see, but he's going to dig his heel into the chair to contract his hamstring. If you need more information about sort of what those tests look like, you can click the video above, and I will walk you through that. But he's going to do a hamstring contraction test to see if his hamstring is actually part of the problem. That will help answer that question. Is it hamstring or is it not? So here we go. Just keep in mind though, hamstring does not cause like pain all the way sometimes down into the foot, or really that far down the thigh usually, and not the burning above the level of the hamstring where it attaches at the butt bone. He's got pain kind of in the central buttock and it burns. Burning is usually more of a nerve description, something like that. But point is that he's curious, so we'll just go through and we'll check it out for him. So here we go.
Way up high. The second one, when I had this past October, I mean, it's still tight. Like when I stretch, I can still feel it.
Mm-hmm.
I don't know if that's because that's kind of in that area. There's right at the top, very close to butt pain. I don't know if that's an aggravating factor or.
Yep. Show me where you get the hamstring. Generally won't refer all the way down the leg to the foot, right? So, that's a weird referral pattern, but go ahead and just lay down and curl, like dig your heel into the chair for me. Okay. Like this. Let me show you. You're going to take your, in this case, right leg at 90 degrees. Okay.
Yeah.
And I want you to dig your heel like you're trying to crush through your chair or whatever it is, and just generate some force through your hamstring and push pretty good and see what you've got there. Okay. Your right heel, like you're trying to crush it.
Yep. Okay.
Any pain or problems?
No, I mean, the burning, the constant burning.
So he has no additional pain or problems. It's not increasing his symptoms. Usually, again, you contract and you pull on that hamstring tendon attaches right to the buttock bone. So you start trying to pluck that thing off with a lot of force through that tendon. Generally, it's going to aggravate it. Not generally, almost always it'll aggravate it. So that does not bother him. Again, it's pretty much tells me, especially along with his referral pattern and how it all started. He didn't say, hey, I was doing a sprint, right? Or I was doing like an excessive amount of activity and my hamstring started to bother me. He just said, hey, I've had this in the past. At least that's what he thinks. And I was cleaning the car. Cleaning the car generally doesn't put a lot of load through the hamstring. So I highly doubt, especially because it was like not there one day and it was there the next day, a hamstring tendon problem usually doesn't develop like that. All right. So probably something else. And when he contracts, it doesn't reproduce the pain. So again, we're thinking not piriformis. He can stretch it just fine. Not hamstring. He can contract it just fine. Something else. He doesn't have any back pain though. So we've got to consider that. Let's keep watching.
Yep.
But nothing anywhere else.
Okay. Let it off.
Okay.
That doesn't make it worse per se. It's just there, right?
Correct.
Okay. Now, if you get up and you just like stand for 5 minutes, how long will it take the burn to go away, or will it not go away? Will it just kind of stay there until you take your gabapentin?
If I walk around, it seems to help it a little bit. It won't go all the way down.
So remember, we're looking to see, is this problem a motion-based problem? Can we reproduce this motion? It seems like it was brought on by some motion or activity of the, doing the car or whatnot, but we're trying to see, can we make it worse with motion, reproduce it? Because if we can, then we can always, almost always reduce it or make it better with motion. So let's keep listening.
But it'll definitely help it when I'm moving.
Okay. So go ahead for me right now and just do this and do it for me like 10 times.
Yep.
So now his symptoms are kind of just at baseline. We haven't really been able to make them better or worse. So that's a constant. Pulling on piriformis doesn't do anything. So that's, again, probably not it. Contracting hamstring doesn't make it worse. I would expect that it would deflect from baseline and get worse if it was any of those things. All right. So I'm trying to see, again, is this thing motion based? And now I have to look at the back. And an easy way to kind of rule out the back is just test the extremes. So, the extremes of motion are going to be really bending forward, and you can do that seated. As you'll see, I have him do some stuff in a minute. You can really test kind of the clock. So if this is 12 o'clock, this will be, 11 o'clock, right? This will be 1 o'clock. Got a little tethered by my cord there. And then, you can go backwards. You can go back to the right, back to the left. This tests kind of all the different positions of the spine, and you can do it repeatedly, right? To see, hey, can I reproduce anything on my butt? Because remember, he has no back pain. So right now I don't know if it is back can contribute or not, but I'm going to have him go through extremes of motion in the spine to see, can I change anything about his baseline burning in his butt, his leg, or his foot, okay? The fact that he went through the leg raise tells me he doesn't have a lot of nerve irritability or sensitivity because he could stretch it on either side. So he doesn't have sciatica, but he may have some irritation of the spine or of the nerve, you know, via compression at the level of the spine. I don't know. We'll see what happens when we look at back motion. So if you're wondering, hey, is my butt pain due to a back problem? Then go ahead, test going all the way back, test the corners. And if that doesn't change anything, test going forward, do it repeatedly or hold it there. Sometimes if the symptoms take a while to come on, you might need to hold it and spend some time in that position or do more reps. And then and only then, after you've gone all directions and nothing reproduces, can you be pretty certain that it's not, without an MRI or anything, that it's not the back. But let's see what happens. He's got baseline burning. We're going to bring him through an extreme of motion.
Seem to kind of radiate a little bit more down the back of my leg.
So I had him do like 10 reps.
It almost kind of up a little bit onto the front of the knee.
Things are a little worse.
It just does a lot.
Okay, go ahead and do more of it. Okay.
I need more data. So he did 10 and he said, I think it got a little bit worse, but I'm still not so sure. I want to make sure it's not a fluke. So when in doubt, I have him kind of rep it out, do more of it. So again, I can collect every rep as a data point. Bloop, 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 and I can see, is it getting worse? Is it getting better? Is it staying the same? What's happening to symptoms? Here we go.
So again, what happened there with more?
Another
Very
10,
similar.
another 15.
It seems to, when I kind of go all the way back, it seems to take a little of the burning off, not completely. And again, I was still getting that kind of running down the back of the thigh and right around up into here.
Okay. All right. The foot, what do you got in the foot?
The foot's kind of on fire right now.
The foot's on fire. So he's got buttock burning, went down the leg, kind of to the knee, right? All the way down to the foot. So going backwards seems to have made it worse. So all I'm trying to do, think of it like this. I'm trying to find the light switch, the motion, right, that can reproduce the symptom. So we did a back bend. Let's just say the lights were off, his symptoms were off, right? We were able to turn his symptoms on and make them worse. Now I'm going to see if I can shut them off. And then I want to see if I can turn them on again and then shut them off again. All right. So I'm going to, just to make sure it's a fluke, I'm going to play with motion to see if I can reproduce it and then take it away, reproduce it and take it away, so we can be as certain as possible that we can solve this using motion. Because again, if it's reproducible, it's usually reducible. So here we go. His foot's on fire after doing 20 of those about. All right. Now we're going to try to take it away.
Okay. So increase the foot?
Yeah, a little bit. Like it seems like more on the top versus just the toe area, the big toe.
Yeah.
And just one other thing that I don't know if it means anything at all, but I think I got plantar fasciitis on my right foot as well.
Okay.
Had it before, and I get that thing in the morning, and it's, you know, a heel pain and pain in the arch.
Yep.
So that's not helping the pain that's going down my leg, you know, for the other reason. So
I get it. Go ahead and take a seat on that white kind of couch or whatever you got there. And I want you to do this for me now, Tim. I want you to, when you're seated, go ahead, take your hands and try to palm the floor all the way as far as you can go down and hold it there.
and hold it.
So there's a nugget for you. The thing that is opposite to that which makes you worse is often the thing that can help you. So we'll see here what happens, but that's the reason. I know what this does. It makes them worse. What's the opposite of worse? Better. What's the opposite of this? Going all the way forward. A big nugget for you to take away. By the way, his plantar fascia problem is probably due to like an old back issue, but I didn't say that. We're going to keep going.
Yeah, hold it.
All right. How far apart on the legs?
Whatever's comfy is fine.
Talk to him about the foot. So he goes ahead and he's holding this. I'm just having him sustain. It's just easier going that direction. 30 seconds, 45 seconds, a minute. Let's see what he says.
It definitely feels better. The butt feels a little bit better too.
Just keep staying there. Keep it there. You okay? More data.
Yep.
Keep going.
Talk to him about foot, butt, leg.
Another 30 seconds. another
Definitely
60
both
seconds.
better. Fairly significant, less amount of burning in both.
Keep it held.
Both are much better. I want him to get it as low as
If
possible.
it was like a 10 before, where is it?
Right now, at this second, it's probably down to about a 2.
Okay, see if you can get it to go to a 0.
I mean, it's pretty close to normal right now, you know, a tiny bit, but
been down there for about 2.5,
I
3
mean,
minutes.
my butt feels pretty good. My top of my foot,
Changeable.
good.
Stand on up. Okay, now when does it return?
Like it's starting to return a little bit on the top of my toes. The butt still feels pretty good. Yeah, I mean, it's still that. It's just a little bit more on the toes than it was at the end down here. You know, it's still in the butt, but nothing like it was before. You know, a little bit more than it was when I was doing whatever you call that.
Yep. Okay. Go ahead and bend backwards again for me.
Okay.
20 times. Doing okay?
It's coming back a little bit, like down the back of my leg.
We turned it on. We shut it
Yeah, it's
off.
getting
Now we're
worse.
turning it back on.
Yeah, it's definitely getting worse.
It's getting worse again.
It's not down to the foot yet, but it's definitely in the rear end and the
We found the switch,
back of
the
the
motion switch.
Okay, let it off. Give it a number now. It was a 10, then we brought it to a 2 or a 1 or almost nothing, and now what is it?
Probably in the 4-ish, 5-ish
Creeping
range.
back up.
Okay, now go take it away again.
I could have
Yeah, I
kept
mean, it's
having
pretty
to-
close to gone.
Okay, 1-ish.
Yeah, it's like probably a 1-ish now. Like the butt feels pretty good, better than the foot, a little bit on the foot, more than in the butt.
Okay, stand on up. What do you have right now?
You know, probably a 1 right now. Again,
Not
a
too
little bit on the top of the foot.
Yep.
Very low in my cheek.
Okay.
Really nothing in the back of the leg right now. I mean, a little bit of warmth, but not too bad.
Perfect. So hopefully that was helpful. So we turned it on. We turned it off. We turned it back on with the back bends. Then we turned it off with the forward bend. So there's definitely a back component, even though he doesn't have back pain. He has buttock pain, leg pain, right? But it could be deceiving. It's like, oh, you don't have back pain. It's not a back problem. But we can change it with the back motion. So that obviously gives him the best evidence that I have to say it's probably a back issue. Doesn't tell me exactly, is it disc, is it joints, is whatever. We can get some ideas, but the point is that it's a motion-based problem. I know that I can bring it on, right? And I know the movement pain relationship, right? He's got some lack of motion or restriction going backwards that we need to try to improve. So point is that diagnostically, we went through, we found that it probably wasn't a piriformis problem because we had him move his hip a couple different directions and it was symmetrical to the other side. And actually it made him feel better. So, or just relieve some pressure. So definitely didn't aggravate it like it should if it's a piriformis thing when stretching the piriformis or hip joint in that direction. The next thing we did is that we had him contract his hamstring because he said, hey, well, maybe it's this. So I had him contract it. A muscle that you contract, if it's a problem, it's going to scream and say, ouch. It didn't. So we said, okay, probably not that. Plus it doesn't make sense with the referral pattern. Next thing we did, okay, is we said, all right, well, could it be a back problem even though you don't have a back pain? So what we did is we used extremes of motion, right? Different ways to try to see if we could turn it on, turn it off. And then I just wanted to be doubly sure. So I turned it on again and then I turned it off again. So that helps us again because we know that it's a motion-based problem and it tells us also how to treat it because now we know that what he likes and what he doesn't like. That's all you need. You don't need a better diagnosis than that. It's not going to lead you any further to the solution. So while he goes, if he wants to get more images and stuff like that, that's fine. I'm going to fix it. How I'm going to fix it? By doing more of the motion that he likes and teaching him how in his life to do less of that which ticks him off. You combine that, you tip the scale towards healing. And that is how you start to determine the solution and get on the path to healing. So if you're looking for something similar, looking to get the bottom of your piriformis glute type pain, then just go ahead, check out the description below, visit www.calldrc.com and apply to chat with me. So hopefully it was helpful when it comes to figuring out, is it a back, butt, hip, leg problem that's causing my pain in the butt or burning in that area. So that's it. Until next time, this is Dr. Charlie. Hopefully you found that helpful. Take care.